okay? This is a mask. Very, very important that we wear our mask correctly, so that those of you who are hearing impaired, and because, as many of my friends remind me, I never did shake my accent, I'm going to take that off so you have a better chance of understanding what I'm saying. Before we turn to COVID, I do want to announce we'll have more details on this, but I am pleased to announce that we will have a countywide working group on new directions for public safety and positive community change. This emanated from a discussion that several community and faith leaders held with myself, Chief Renee Hall, City Manager T.C. Broadnex, and John Crusoe several Saturdays ago. After this conversation, those community and faith leaders drafted a document which they asked us to review, and they asked me to post on the web, and which I have. In the document, they asked for me to create a working group to address their concerns, and we have. There will be several members of the community. It will be a bottom-up, community-driven conversation. There will be 3 pastors who are on there, and a host of community activists. The pastors, some of you may know, Dr. Freddie Haynes, Dr. Michael Waters, Imam Omar Suleiman, and then we will have the city managers and the chiefs of 7 departments on the task force as well. Those would include the city of Dallas, the city of Balch Springs, the city of DeSoto, the city of Irving, the city of Lancaster, and the city of Mesquite. Our DA will also serve. If you're a fast mathematician, you may see there's more city folks than there were pastors. Again, there are activists on there as well. Regardless of the numbers on there, 50% of the vote will be with the community. And so if the task force has recommendations that come out, it'll have to have agreement or buy-in from community and from government. That task force will be co-convened by one of the pastors, and also Daryl Martin, who is the county administrator here in Dallas County. The hope of that is quite simple, and we talked about it before. We've got an opportunity right now, if we seize it, because attentions will turn elsewhere. We have a lot of allies focused on policing right now, and the plight of our black and brown neighbors when they are having routine interactions with the police. But soon attentions may turn, as they are today, to the COVID surge, or to the presidential election, or to things in someone's life, their job, or a family emergency of some type. So now is the time for us to work together to radically transform policing, to build that more perfect union where not every black and brown parent has to have a talk with their preteen child about how to survive a routine police interaction. That won't happen overnight, and those conversations won't be easy, but it's very important that we have them. And I'm very hopeful and I'm very prayerful that good things will come from that. I want to turn my attention now to COVID. We continue to see essentially a wave of cases happening with COVID. I want to give you some numbers for you to just kind of understand the gravity of the situation that we're in. The number of COVID hospitalizations, and think of hospitalizations, I may have used, I think I have with you, used the analogy before, as the tip of the iceberg that is above the water. It takes a heck of a lot of sick people statistically for one person to be in the hospital, okay? And so when your hospitalizations have gone up 88% for COVID here in Dallas County in 24 days, since the first of this month until today, we're up 88% in this county, okay? So that means that part of the iceberg that's under, for this thing to dang near double up here, that base of sickness of the iceberg under the water that you can't see is increasing exponentially. And we're seeing that. We're seeing that one of the fastest growing groups of people that are sick with COVID are people 18 to 39 years old. And you say, well, isn't that a good thing because don't they have a better chance of survival? Well, they get real sick. We've got them on ventilators. You know, there are some very sick young people right now with COVID, and as you know, we've had some that have died from COVID. But what else we know about young people is they're more social. They're working the jobs like waitressing and working at the grocery store where they are bumping in to a lot of people. And then a lot of young people are more social, so they're going out with friends. And the more you're around people, particularly when you're not wearing a mask, the more it spreads. And so we've got a situation today where we've seen skyrocketing numbers in the whole state over the last 4 or 5 days, and we're going to have to take some actions to control that. I'm asking the governor to do several things. I'm asking them to look at the Open Texas document and look at those requirements in the Open Texas document. Those things like spacing of work stations and those things like putting people to work in shifts so they're not all together. All the things that he's talking about in there that he's making recommendations to make a lot of those requirements. And I'm asking that they look at things like bars. I mean, folks, do we really need to go to a bar right now, given that the situation that we're in? Not to close all businesses, but to look at the businesses where I'm asking him to do it, but I'm asking you to do it until he does or unless he doesn't. Look at businesses where you cannot go to the place and wear the mask all the time, or your fellow people there aren't wearing the mask all the time. So if you're going to a spin class where everybody wears the mask into the room and then takes off the mask and pants and breathes heavily for an hour, your breath is traveling about 10 times farther and you're expelling a lot more volume at the spin class without your mask on. So maybe there's a different way to exercise for now during this surge. And the bar, please stay out of the bar. And there are other examples of this. Anywhere where you're going and people can't wear their mask all the time, just don't go there. And we need to work very quickly. Another place where I'm asking for the state to come in and help, but I want you to take a stand on it as well, is we've seen a big increase, the beginning, statistically big, but the beginning of an increase in kids getting sick at daycare. And remember, we had that conversation. I was criticized quite a bit for it, for having a conversation with you a few weeks ago when we just started to get cases in nursing homes. And I said we have to have a difficult conversation, and if there's a way to get folks out of the nursing home, you may want to consider that. And people, understandably, a lot of people with hurt feelings. And I understand for a lot of people, there's just not an option, right, to take your loved one out of a nursing home. And similarly, there's not an option to take your child out of daycare. But here is an option for us. I'm asking the governor to make this a rule, but mamas, we know how this works. You can make it a rule. Make sure your daycare is masking all the kids over 2 years old, okay? Make sure that your kids are staying in their group and not playing with the other groups. Make sure that the kids aren't using playground equipment that other groups are using. Make sure that the kids aren't eating in large congregate or group settings with other groups where they're taking their mask off and all breathing, on one another. These are some ways that we can keep our kids safe. I'm asking the governor to quickly put those into orders, since they've taken away our ability to do that when he took this over in May. But you can do it right now, Mom and Dad, by just talking to the other parents at the daycare and making sure they're doing these things. All right, we have seen the number of cases go up 62% since the beginning of June. And of course, some of that may be due to testing. But we've also seen that go up. If we want to go exactly a month ago, so 30 days, it's gone up 136%. Some of that's due to testing, but the hospitalizations are not due to testing, and we've got a lot more sick people out there, so we need to be a lot more careful. Dr. Wong will have some more information about the spike in ER visits for COVID when he speaks. I want to talk to you about our federal testing request and what's happening with the test sites now. We're working with our congressional delegation. I know both of our senators are working on this, bipartisan. All of our members of Congress here are working on this, and we've made a request. And here's our request to the feds. In the face of what has become a second wave of COVID, we just cannot afford to lose any of our testing assets. We need to dramatically expand testing. We're seeing so many more people line up for tests that people are waiting hours sometimes to get a test, because when we get there to the sites in the morning, there are hundreds of cars at 8 o'clock ready to go through, and we run out of kits before the day is over. Okay, so we've got a vendor on the ready, so that if nothing happens with the feds at an expense to the county and the city, we can keep going with what we have. But what we need is to keep going at a greater capacity, because we have more sick people, we have more people getting tested. And so here's how we could do that. We talked about this a little bit before last month, but nothing came of it. At Parkland, we have a machine that can test 1,500 COVID tests a day on a 1 to 2 day turnaround. But we don't have the reagents, the chemical, to run that machine. There's similar machines at University of Texas Southwest, or UT Southwestern, that can do about that many, about 1,440. So we're asking the feds, hey, don't spend the money on your lab anymore. Just give us the reagents to do it for ourselves, because we can get it done faster. We need that faster turnaround time that helps us in fighting COVID. We need that faster turnaround time, and also we still need the nasal swabs, which are in short supply. We need those things, and then we can do this. It saves you money, it makes it better for us. That's the partnership we're asking for. If for some reason you can't do that, then the partnership that we're asking for is keep doing what you're doing. We'll use our vendor and our CARES money to do other locations and continue to expand. Either way, and I'm very hopeful that will happen. Each time, the way these negotiations work is, for some reason, it ends up being at the last minute when we get things done. We're a week out. I'm really hopeful that we'll get this done soon rather than the day before, the 1st of June. But at any rate, or 1st of July rather, but at any rate, that's where we are. Now let's talk about what's going to happen with the American Airlines Center. That will be moving to the University of Dallas in Irving. Now, if we don't work out a deal with the feds to get more federal assets, and we're using CARES Act money for the city of Dallas and the county of Dallas, then the only people that will be able to get tested at our facilities will be people who live in Dallas County. This is because the CARES Act money must be spent on the people in the jurisdiction where the CARES Act money was sent to. And so if we don't get those federal reagents and those federal test kits, you'll need to take some proof beginning on July 1st that you actually live here. That doesn't mean you need a picture ID. A water bill, a utility bill, anything that shows that you live here can get you tested. But if we don't work out a deal with the feds, we will not be able any longer to service people from other counties. We will have additional information about other new locations, and we'll have we'll get you information about the hours and whatnot at the University of Dallas. And I want to thank the City of Dallas for the partnership, but also I want to thank Irving for their help, and of course the University of Dallas and the diocese for their help on that. We're going to partner and have 3 additional walk-up testing locations that are currently open, and whether we work our deal with the feds or not, our vendor will have these open. Those are Redbird Mall, Inspired Vision Church, and Sam Tasby Middle School. That's Vickery Meadows area, right there. Well, you can look it up on Google, but it's right there where the roads meet. Okay, now let's talk about mass gatherings, because I know we're coming up on the 4th of July. The governor has given authorities to county judges and mayors to limit mass gatherings. I've asked our doctors, led by Dr. Huang and others, to look at this and give advice. We'll have an order on the Commissioner's Court for an emergency meeting, and I don't have that done yet. But well before the 4th of July, probably a meeting on Monday if I had to guess, we'll have an order that will limit crowd size, but will have exceptions for the things that are protected by the Constitution. And I'm also trying to work with our partners at the state level on exactly how far that can go. But we'll have information on that. So what does that mean for today? You're saying, Judge, you're going to do something, but you're not telling me what it is just yet. Well, it means if you're planning something big for the 4th of July that is in excess of 100 people, you just need to be aware that there will be a order presented to the Commissioner's Court, and probably similar orders presented to city councils throughout Dallas County that will restrict that crowd size. We've had people that tell us that it's hot in Texas and the mask is hot, or they're having trouble breathing with the mask, not while they're jogging or whatnot, but just they have trouble breathing with the mask, and that's a reason why they don't want to wear it when they go to the grocery store. Well, some people truly do have trouble breathing. They're on oxygen. They carry it with them wherever they go. But I would just ask those of you to remember, because it is uncomfortable wearing the mask, but it's a slight discomfort compared to the discomfort of a ventilator. And although you're feeling discomfort and your mask is itchy or tight, so are all the other people's who are masking to protect you. So please do your part and mask to protect them. I want to also give a special shout out to the town of Addison for taking special precautions in light of the growing COVID-19 spread. Even before the governor allowed us to control crowd size, they have moved their annual Kaboom Town fireworks show to an online television display. In just a minute, I'll be turning it over to Dr. Huang and Dr. Brett Moran with Parkland to discuss the new automated contact tracing system that we rolled out on Monday. This is an exciting collaboration, and it's going to help supplement the hundreds of healthcare heroes who are currently working to do the best they can to keep up with tracing. And that's quite a Herculean effort on the part of these folks. Each person who is sick averages about 10 to 12 contacts that need to be traced, okay? So you can imagine, we started off with a system that dealt with like syphilis and tuberculosis, other communicable spread diseases that require contact tracing. Well, there's not a lot of that. So the 16 to 30 employees that worked on that normally could get to that. And then suddenly you've got 30 COVID cases a day, then 50, then 100, then 200, then 300, and a week later then 400. And with each of those cases, 10 to 12, and sometimes a whole lot more if they got it at a larger gathering. And so they're doing everything they can to keep up, and this program is going to help them. So now I'll turn it over, I'll get my mask back on, and I'll turn it over to Phil.
Okay, first, I'm just going to review some of the numbers for today. As the judge reported, we're reporting 403 new cases. That brings our total case count to 18,538. We are also reporting 6 deaths today, which brings our total number of deaths to 334. As the judge mentioned, we've been seeing record numbers of some of the indicators that we've been monitoring, and I'll show them in just a second. I do want to emphasize a few other points that the judge made. just, when we're seeing these record numbers of hospitalizations and admissions and things, it's very concerning about these mass gatherings. And so, as we're getting close to July 4th, just, we all want to celebrate that, but we strongly urge cities to cancel any in-person fireworks celebrations and consider alternatives. The potential size that can occur when these events occur, makes it very likely that you would see spread of COVID-19 in the venues where people might be watching them, and particularly persons in high-risk groups, persons over 65, those with chronic health conditions, would be really vulnerable to that. And I want to echo the judge's really sort of recognition and appreciation for what the city of Addison has already done. Really, I know it's a hard decision, but for them to cancel their in-person event and really to do the fireworks in a remote area and live stream it is a perfect way to continue the celebration, but be able to share it with the community. And we really, again, applaud Addison for what they're doing with that. Other comment, again, with these mass gatherings, we know that there's a lot of graduation ceremonies that are still being planned, and we all want to recognize and celebrate the great achievements that have been made, but it is very concerning, the potential sizes of these crowds and interactions with the household members, and they tend to bring family members, and a lot of times family members who are in those high-risk groups. Certainly indoor graduation ceremonies and in stadiums and football fields are strongly discouraged, and we really encourage the use of virtual graduation ceremonies. The other thing, let's see, two other points, that businesses, we're hearing a lot of them, businesses requiring negative tests for employees to return back to work. And just a point that is actually violation of the judge's supplemental order, which specifically prohibits employers outside of healthcare settings from requiring negative COVID-19 tests or a note from a healthcare provider as a requirement before going back to work. Because these tests are really for diagnostic purposes at this time, and we're asking that employers really wait to get that recovery and follow the CDC guidelines for non-test-based strategy to determine when individuals can safely return to work. I do want to then go through just the numbers for our monitoring that we are doing. As we mentioned, we're still in the red zone right now, the high stay home, stay safe. We monitor, next slide, the number of suspected ER visits for COVID-19 in the last 24 hours. As you can see, the last week period, the last few days are close to record numbers. Certainly the trend and the 7-day trailing average is in that upward direction. Next slide. This is available ICU beds in Dallas County, and this is a line that you don't want to be going down because it means there are fewer available ICU beds, and unfortunately you can see that trend since April 24th time or 17th has been continuing down. Next slide is the general hospital admissions for suspected COVID-19 in the last 24 hours. Again, you can see significant uptick in trend on that, steady sort of trend up. Next is the trend for ICU admissions for suspected COVID-19. This one actually has been a little more flat. That's good news. One of the things, we have been, in terms of, and I'll talk about the deaths, some of the more severe illness because of some of the trends in younger persons may be accounting for why these particular trends aren't as dramatic. Next slide. This is for just the general hospitalizations, the hospital census, and these are where we are at record numbers, and you can see these are the highest we've been since this entire COVID-19 epidemic. Next slide. This is the lab-confirmed ICU hospitalizations that are the census numbers, and those have been showing that sort of steady increase in the last 2 weeks. Finally, just the mortality. As I mentioned, it's been more flat than some of the other indicators, although in the last week or so there have been an increasing trend on that indicator also. So, so those are most of the numbers. Those are the key numbers that we have been monitoring to be able to move to the orange risk level that we're all hoping to get to. And the last thing, so I'm going to turn it over to Dr. Moran, and the others. Contact tracing is a very important piece of addressing this situation. It's a core public health function that we do at the health department every day, even before COVID-19, whether it's monitoring HIV or syphilis or people who have TB and identifying contacts and following up. It is a tried and true public health function and activity, and we're really excited about the partnership with Parkland Center for Clinical Innovation, really to bring some of the latest technology and resources to address and supplement our contact tracing efforts. Because as we've seen, we're at record numbers of cases. So, it's a Herculean task, as the judge mentioned, for the staff that that have been working on this 7 days a week, late nights every night, to try to keep up with this, and it's very difficult to keep up with the numbers that we're having. But this is a tool that will be helping us to really accomplish this, and we're very appreciative for that partnership. So let me turn it over to Dr. Moran.
Thank you, Dr. Wong and Judge. Good afternoon, everybody. I'd like to spend a little bit of time talking about our proposed semi-automated solution to COVID contact tracing. And if you go to the next slide, you can see there's been a lot of press about COVID and contact tracing, and it is a very valuable tool for helping slow down the spread of disease. And if you go to the next slide, the first thing people often ask is, what is contact tracing? And contact tracing is a tool that's commonly used by health departments to help control the spread of infection. And at the premise of it is that the contact tracer reaches out to a person with COVID, they find out who they've had close contact with, and they communicate with those people to help them reduce the spread of disease. And so trained contact tracers will interview persons such as an index case, and they will trace back who they've had close contact with, and then they will reach out to those individuals and take appropriate actions. In the case of COVID, the action would be to assess if they have symptoms. If they have symptoms, to go ahead and get them tested. If they don't have symptoms, to ask them to isolate and to monitor their symptoms for 14 days after that close contact occurred. Next slide. If systematically applied, contact tracing can truly break the chain of transmission of COVID. And certainly it can reduce the transmission and reduce the rate of spread. The critical elements to contact tracing include community engagement and public support, which is why we're here today. And it's very important for people to understand the value of contact tracing. This is information to help us help ourselves, our family, our loved ones, our coworkers. And providing this information to the contact tracers or through the survey that we're going to be sending will help us help those people. Obviously, there's also the consideration of local context, values, communities, and cultures that are important, and then the trained workforce of contact tracers and logistics and analytics. Contact tracing at its root is about engaging the community about the disease, how to protect the individuals and the community, and suppress the transmission of the disease. Next slide, please. In the past week, Dallas County has averaged 411 new COVID cases per day. Now, some people estimate that a single contact tracing with an individual may take 40 minutes or longer. And when you do the math, and it's fairly simple math, if a contact tracer team works 12 hours a day, 7 days a week, you would still need over 1,300 contact tracers to do the work to support the number of COVID cases that we have. As the judge mentioned, it's just unsustainable, and there has to be some other solution. And that's why we have worked with the health department and with Parkland Center for Clinical Innovation and come up with a proposal of a semi-automated solution of sending surveys to persons who are COVID positive. By no means is this to be considered a replacement of manual contact tracers. By no means is this considered better than a manual contact tracer. But given the pandemic that we're in, we hope that this solution will help us get a better grasp and be able to contact people in a timely manner and protect them and their family. And also, by no means do we think 100% of people are going to respond to this survey, but we hope even if 10 or 20% do, that's enough where we can take a little bit of the load off of the contact tracers and provide some extra support for them so that they can do the important work that they need to do. So next slide. So in a nutshell, the way this works is a person tests positive for COVID. Next slide. That information gets transmitted to the Dallas County Health Department. In the next slide, that goes to the Parkland Center for Clinical Innovation, which then it goes to Parkland. From Parkland, we send out a survey. It will be a text message going to the person who is COVID positive. They will receive the text. It will say, please follow this link to provide information about recent testing. And it will then ask them information about people that they have had close contact with. And close contact would be somebody they have been within 15 feet with, or I'm sorry, with 6 feet for more than 15 minutes. And these are people they may live with. These are people that are close, family, friends, co-workers. We will then get that information and pass that to the data warehouse, which is stored over in the health department. The contact tracers can then work that list. If there is a survey that is partially filled out, they can contact the persons and follow up and provide feedback and continuity on that. Otherwise, that's information that we have helped the contact tracers capture that would have otherwise taken a lot of extra time. As a second phase, we're having conversations with the health department about sending out surveys to people who are close contacts to let them know that they have been identified as a close contact and to offer them the opportunity of daily symptom monitoring. And if they opt in for that, we would send them a survey each day asking them which symptoms they've had, if they've had any symptoms, and just a reminder to help them monitor their health. If they test positive or identify positive for symptoms, we would then direct them to get testing at one of the local sites. So next slide, please. This is what the sample text message would look like. And again, it would be coming from Parkland. It would also be coming from the company that we're working with to send out the surveys named Qualtrics. So if you get a text from Parkland about this is a text we would like you to fill out. This is important. This will help us work with the health department to identify close contacts and people so that they themselves can isolate themselves, get tested if necessary, monitor their symptoms. Next slide, please. So we have gone live as of Monday the 22nd, and to date you can see we have had 955 surveys sent out. We've actually had over 50% of people respond to the survey at least partially, and 12% of people have completely filled out the survey and filled in all the information. We have captured 225 close contacts who have been identified so the health department can start reaching out to them. And some interesting facts, 18% of them were completed in Spanish language. The survey is bilingual. And over 5% of them, one of our highest zip codes within the top 10 came from a zip code in Dallas County that actually has the lowest life expectancy based on the community health needs assessment, which is a good thing because it shows that despite socioeconomic disparity, people can use this survey. It's easy to use if they have a phone, if they have a computer. It's a fairly easy tool for people to use. If you go to the next slide, you can see the race and ethnicity breakdown. The largest population is the Hispanics. About 16 to 17% are black or white, and then a smaller population for the rest of the people. On the next slide, I just wanted to recognize the hard work of the Parkland and PCCI team, these 9 individuals, without which this project could not have happened. And then, of course, the extensive involvement and help from Dr. Wong and Dr. Wendy Chung at the health department, so thank you for that. The last thing I'd like to show is just a video demonstration of what the survey would look like. So if we can pull that up. So you can see, I think we went a little too far here. Can we back up a little? There we go. So when a person gets a survey, they'll get a text message, they'll click on the link, it will take them to this page. It will be a web page. It will resize for the phone so you can see what it would look like if you're on your cell phone. You can change it to Spanish. It will also detect the language of your browser, so if your browser is set to Spanish, it will automatically do that. And then it asks for some basic information about you, the person who tested positive for COVID, so that the health department can make sure that they have the right person and that they can map up with the information. The next slides will have a few questions about some basic demographic information. Are you employed? What is your race and ethnicity? And then to verify, did you truly test positive for COVID? And if you tested, where did you get tested? To verify the information, ensure the accuracy of it. Have you had any symptoms, and what symptoms are you having? This is good information from an epidemiology standpoint. And then, do you have any medical conditions? And you can see on the phone, it's pretty easy to go through as well. You can just use your finger to scroll down and select whatever conditions you may have. And then this is the most important point of the survey, which is, have you had any close contact with anyone? So within 6 feet for more than 15 minutes, how many individuals do you know that you've been close to? And then on the next screen, give us as much information as you can about them. You don't have to give us everything if you don't have it, but give us as much as you can, and the contact tracers will try to get the rest of the information. That information then goes to the health department. They will then have dashboards. They can see how many surveys have gone out. They can see some of the answers, whether people have tested positive, what are their health conditions. So they'll have dashboards, but most importantly, they'll have work queues for incomplete surveys, where they can actually go and see the incomplete survey, click on it, call the patient up, get them on the phone, and complete the survey as they speak to them. So again, by no means does this replace the contact survey, but it may help work with them and offload some of the work and the rote work that they would otherwise do. And then finally, as I said, we're looking for a second phase, which may go live at a later date, where we would be able to give people an opportunity to opt into symptom monitoring if you are a close contact, and you would get a daily survey sent to you by text. You could then fill it out on your phone, as simple as displayed here, just answering these 12 symptoms. If you test positive for any of these symptoms, we would then send you another text back giving you a list of local resources for COVID testing. So this is the demonstration of the semi-automated process for contact tracing. Parkland and PCCI are very excited to be working with the health department, and we are hopeful that this will be something that can help the community slow down the spread of COVID. And I'll stop here if there are any questions. Thank you very much.
Any questions, anyone?
So this is a proposal, right?
No, this is live.
And you kept calling it a proposal. Why did you do that?
Well, I apologize. It's a pilot. So we have gone live with this pilot. And this first phase where we are sending out information to people who have COVID to get their close contacts, we're still trying to work out what's going to work and what doesn't work. For instance, some people are having difficulty understanding, fill out a number of contacts and then fill in the information next. And so we're optimizing the survey as we go. So before we move to the second phase of symptom monitoring, we want to capture more information and make sure that this is working well. So the proposal was to do this. We have, Dr. Wong has agreed to do it, and this is the pilot.
Sure. And generally, they're just when contact tracing first sort of made a big splash earlier on in the pandemic, there were a lot of concerns about people's privacy and data mining and tracking. Can you kind of walk through some of the protections users might have or what they should expect?
Sure. So the first thing is that I think there's been a lot of publicity about contact tracing apps. This is not that. This is not tracking your phone at all. This is merely a text message that takes you to a website. It does not track you or trace you or put anything on your phone. And so that's one big distinction. There are those apps, and those are things people have talked about. This is not that. The information that is provided does go to Parkland, and we provide that to the health department. We do have a memorandum of understanding that data is triple protected behind firewall, triple redundancy on servers, and we do not use it for anything other than this collaboration we're doing with the health department. And at the end of the day, the data goes back to Dr. Wong's shop, and they use it for their county health department purposes.
And you're blasting out the text messages based off of a list the county gets from people who have tested positive from all the different labs. So that's where you're getting the original
Correct.
source list.
Correct.
Can you talk about, is there a maximum amount of people you can text this out to? I mean, is there a limit as far as your servers are concerned, or I mean, can you text this out to as many people as possible?
No, there's no limit on the number of people we can text this to. I'm sorry, go ahead.
Repeat his question.
Oh, I'm sorry.
Answer it. He's not mine.
I'm sorry.
This thing's on the.
I apologize. So the question is there a maximum number of people that we can send the text to? And the answer is no. The only limit is how much bandwidth we have with our vendor, and that's something that we can always adjust if we need to. With the current setting, we have many months of availability of texting.
And based off of early data, do you know what proportion of new cases are coming from known contacts? Have you been able to figure that out yet?
So the question is what proportion are coming from new contacts? And I think that's more of a Dr. Wong.
And this was, we just implemented this
Well,
this
repeat his
week.
question, because-
Okay, question was, I guess, number of new cases that are from named contacts. And so we're still, again, this is our new data system that we're just implementing this week. So we don't have that yet. This is part of why we're very excited and feel it's really important for us to implement this so that we can take advantage of more of the technology that's out there. And again, with the increasing numbers that we've had, it's just been very, overwhelming now. And so now this gives us a tool that can really assist us with that.
I know it's only 4 days out, but are there any takeaways yet? Have you been able to glean anything? Are there any takeaways? Anything you find surprising just in this very early data set, 4 days?
One message, the question was, are there any findings or messages or something that we've seen? I mean, I think one message that we really want to get out there, and that's important, is that it's important. This is a key, one of the tools for us to control COVID-19 in our community. And so everyone, if they get this text, answer it. It's not, this is what we're doing, but we want to get that message out because that will get more people participating. And so I think, this was starting out sort of a soft launch where there hasn't been the attention or announcement this is going to be coming. So we want everyone to know, if you get this text, please click on the link and fill out this information because it's going to be important for all of us to get this information and to find those contacts and notify them. And it's our way, it's a supplement, it's not the answer to everything. It fits in with all the other tools that we have, but it's one important piece. And so, for the cases, to isolate, to identify the contacts and quarantine them, and then that's the strategy for boxing in any further spread when you get those. And so this is, we want everyone to know about it and respond if you get this message. And that's the finding, that it's still early. We've got, but still, I think a lot of good response for such a quick launch. How many people are responding, and you saw some of the demographics already of people who are responding. So that's very encouraging.
Yeah, I think that's one of the interesting things is how many people who have completed the survey completed it completely and not partially, who went through it and filled out all the information. And that was, as Dr. Wong said, given that we haven't publicized it too much, that was a good promising sign.
Dr. Wong, I know the Commissioner's Court approved a pretty hefty budget. I was trying to find it for contact tracers. How many contact tracers have you hired since you got approval? And how close are you to filling that gap?
Sure. Question was, that the Commissioner's Court approved additional funding for our contact tracing program. How many contact tracers have been hired thus far? So we were approved for 260 tracers. I know we've been working with the agency for hiring. Many of them going through the background checks and processes. I know 60 of them have gone through all the sectors of the process, and others are sort of in the queue. Those positions are available through our website, and we're very much along, but certainly have more to hire. We have a new rental space for our phone call center that's been identified. They're putting in all the wiring, all the computers, all the furniture. That's supposed to be ready. It's supposed to be ready July 1st. They're still working on it. I just had an update on that a little bit. But we're trying to also, as we get these new staff on, in the meantime, until the place is available, get people where they can be operating also. But we're working on all those pieces simultaneously.
Judge, other than you mentioned bars, is there something specific in Open Texas that you want to see that be a requirement and not a recommendation?
So the question is, what in Open Texas would I like to see as requirements as opposed to recommendations? Well, Open Texas largely took their recommendations were the requirements that Dallas County, my office, and the business community and the health community worked out for businesses. Things like mandatory temperature checks, things like keeping people 6 feet apart, and masking of people, which is now being, finally addressed. Sanitation breaks, taking breaks for sanitation, the shift work that we talked about. And then with each thing that he's opened, he's had recommendations. So for instance, with movie theaters, he said 2 seats between family units and block every other row. But these were only recommendations. I know the recommendations for restaurants, there are a lot of restaurants that have many different rooms, and they could have spread people out to those different rooms, but that would have been a burden on wait staff, and so they've got rooms shut and people in one room. And so, really what I would recommend, and this is an offer that I've made to the governor and the state over and over, is please have a conversation with the healthcare experts, not that you or I choose, but that the hospitals have chosen to be the chiefs of epidemiology, infectious disease, the public health leaders in each of the big urban counties. And let's look through and find those reasonable requirements that business will work with us and want to see happen. Because look, business doesn't want to see a second wave, a crippling effect on consumer confidence, and whether the governor shuts things down or not, people stop going somewhere because they don't feel safe. None of us want to see that. But if we work together now, and the state's going to have to lead on this because they've yanked all the authority away from the counties to do the things that work so well up until May the 1st. But if we do it now, as opposed to wait 2 weeks from now, there's still a chance that we can change the trajectory of this very dangerous path that we're on. But each day that we dilly-dally around or don't do it is an opportunity that's lost, and it's a situation we can't get that back, and more people will get sick. And so we just all need to work together, and it starts with listening to the doctors in Houston and Dallas and Bexar County and Travis County, the people on the ground that are fighting this, and the business communities there.
And on large gatherings, I know you already give credit to Addison, and this is not in Dallas County, but right next door. Arlington apparently is going to hold both the largest outdoor fireworks display around the new stadium on July 3rd. Do you have any message to Mayor Jeff Williams or anybody in Tarrant County about that large gathering?
The question is about large gatherings outside of Dallas County. This is why we need statewide policies. What has happened is when the governor basically in effect said, hold my beer, basically, you guys sit down and I'll take it from here. It's going to be very hard now to get all of these mayors and all of these county judges in these surrounding counties to act quick enough to arrest this surge. The only way to really do this is for there to be uniform rules, at least across the region. Now, I want to commend Tarrant County today because they did, there was talk last week that they wouldn't do a masking requirement on businesses, but they did it. And see, what's happening is as things get worse and worse, people are acting, but we don't have time for that. What we need now is the sort of decisive leadership that we saw at the local level in early March. We need to see that at the state level now, at least for the Houston, Harris County area, and the DFW area and the Bexar County and Travis County areas. That's the only way we're going to get to it in time. If the governor won't do that, then just repeal the order that took away the powers of us to do it. But even so, it will take a while for all those things to get back into place because of what happened on May 1. So the best way for us to do this is for the governor to talk to the local doctors in these areas and act quickly. But we're going to work with the state, and if we're given the authority to act to protect and keep people healthy, then we're going to do it.
What are you hoping to get through the commissioner's court before the 4th of July regarding the gatherings and to limit the crowd sizes?
So I'm asking the doctors to take a look at that and advise me, but I'm sorry, the question was, what are we hoping to get through the court as far as limiting crowd size? So I've got doctors, lawyers, business people looking at that, but as far as we can go, whatever the best way to protect people, which preliminarily the doctors tell me is to limit that crowd size, not to find ways to keep people safe if they're in a crowd of 200 people, but to limit the crowd size as much as they can. It's important to remember that the CDC says when you're in situations like we've been in really for months, but particularly like the one we're in now, you should limit crowd size to 10, and when it gets really bad, you should just stop all crowds, all gatherings outside of your family. So a crowd of 100 is still a really, really big crowd. If it were up to me, I would limit crowd sizes to 10 based on what we're seeing, and I'm asking people to consider doing that. But what you'll likely see once they're, goes through the process of the various people looking at it is an order that would limit crowd sizes to 100, because that's as far as the governor is willing to go now, which is 90 more than the CDC. Any other questions?
On the new directions committee, can you talk about when you expect to have the full roster and when their first meeting is going to be?
Well, as soon as we can get it, as soon as the schedule permits. And there's things. Oh, I'm sorry. The question was on the committee. I don't want to butcher the name, and I don't see my notes. So, thank you. So on the committee, that is the new directions for public safety and positive community change, which incidentally, and the question was, when's the roster finalized and when's the first meeting? By the way, that name was taken from the document the community sent us, because we want an opportunity to hear from the community and make this a bottom-up conversation, not a top-down conversation. We hope to have that committee finally formed in the next couple of days. We need to hear back from people who've been invited. And then as far as a meeting, we'll be checking their schedule, and I'm hopeful that they'll meet very soon. As you know, Nick, because you cover the budget cycle, if we're going to put things in budgets, then we need to have a consensus around what needs to go in the budget in July, so that as the elected officials come back from their break-in meeting, I don't think very many people are leaving on vacation this year, but from their break-in meeting, they'll have proposals to look at, because in September, that's when cities and the county vote on their budget for the new fiscal year that starts in October, and that's basically all the money is accounted for, and you're looking at 2022 before you can do these things. Again, we can easily miss our opportunity here. Rodney King was video. There have been many, many videos. What is different about this? Well, primarily from my perspective, what is different about this is suddenly there is a groundswell of people who are standing up and saying, we demand our civil rights. And there's a groundswell of other people whose civil rights have not been impinged, but maybe it's partly how we see how COVID affects all of us when it affects one. But people who are less affected by this, who've never had that conversation with their parents or their children and never will, saying, you know what, this isn't the America I want to live in. We need to seize the moment, we need to do something. But we got to do that now, because you all know how it works, right? The news cycle changes, it's presidential election, it's football season, it's something, and suddenly the moment is gone. And we're back to watching these horrors all over again. So we've got to really, really work smart, but work fast. Any last questions before we wrap up?
Just one more last question.
Yes.
Have you talked to the governor recently about what's happening in the state and the county with the cases going up?
I've talked to, or I've texted back and forth with his staff, but as far as like a conversation with him, no, I haven't had the opportunity to visit with him directly. But to the extent that he watches these newscasts, my question respectfully, understanding that these are difficult decisions that we're in, would be to sit down with the doctors in the DFW area that are the chiefs of epidemiology, infectious disease, and public health, listen to what they have to say, and then act decisively on their advice. That's our best chance, and do it regionally or statewide. That is our best chance. That's what I did and what local officials did when this state was doing better than any other state. And that's what we need to do now that we're in this problem. And if we do that, then we got a chance to pull out of the tailspin. But if we wait around for another week or two, or these little half measures where we say, okay, today we're going to do one thing, and tomorrow we're going to think about another thing, we just don't have that time anymore. Things are deteriorating too rapidly for that. Thank you all so much for your patience and time, and have a good rest of your day.
I don't think so. I have no idea. As far as the story is concerned. But I think if we do anything, it's gonna be, yes. Okay, let me. Yeah.
We can just have him stand there, right?
It's not the only thing. We'll all make sure my people will. Yeah. I was just like, we're on 7 different things today, and then I get dropped into this, so, yes, I will.
Okay,
We'll be
just let me know.
Yes.
Okay.
Hey, Nick, Mike
Hey, how are you?
That's your mic, right?
All right. Hey, we ask.
Yeah, you can keep telling me to fix it.
Pueden mirar para acá. Good?
Okay.
guys,
I don't
guys,
think so. I think
I'm
we're
doing something
good
for
right now,
Spanish now?
but.
Thank you.
Yes, yeah, good, but we'll circle back if you need anything.
¿Puedes explicar este sistema para rastrear los contagios en el condado? Lo que, en resumen, ¿no? Porque la explicación fue larga, pero...
Es una iniciativa muy prometedora ante el condado de Dallas junto con Parkland y el centro de iniciativa de Parkland. Y